Okay, thank you for the invitation. My name is Francesco Allegri. I teach at Pegasus University of Naples, and the title of my presentation is What Moral Theory for Medical Ethics? As in all fields, human action in the biomedical sphere requires ethical indications that guide the action of those who work in this sector. Such guidelines can only take the form of one or more moral principles. What is the proper set of moral principles that should be applied in the practice of clinical medicine, dentistry, nursing, as well as in scientific research? More generally, what is the appropriate moral theory to support those working in the biomedical field? The aim of my talk is to suggest some indication to answer this question. The method I will follow to establish my conclusions is the so-called method of reflective equilibrium, according to which a thesis, to be plausible, must agree with its responses in concrete examples. It must not have implications that do not agree with our reflective intuitions. If a thesis or theory involves outcomes that conflict with our considered beliefs, this is a good reason to correct it or abandon it. When issues of human behavior are at stake, one of the most classic distinctions to take a position on is between deontological theories or deontology and consequentialist theories or consequentialism. If this is true in general, it also applies when we question human conduct in the biomedical sphere. For consequentialism, the criterion to establish whether an action is morally right or wrong is given exclusively by its consequences in terms of good and evils, compared with the consequences of alternative actions available to the agent. Instead, for deontology, consequences are not criterion or the only criterion to evaluate an action from a moral point of view. The kind of action, its nature, is also important, or it is the only thing that matters. Which of the two is the most appropriate perspective? Another significant alternative on which to take a position is that between monism and pluralism. Is a single principle sufficient to capture all our duties in the biomedical sphere, or do we need a plurality of principles? Trying to take position about these two issues, I intend to argue that an adequate theory for medical ethics is deontological and not consequentialist, and is pluralist and not monist. Regarding the alternative between deontology and consequentialism, I think that the deontological theory is more in accordance with our reflective beliefs than a consequentialist theory. Consequences are not the only important thing when we want to establish if an action is right or wrong from a moral point of view. In fact, all forms of consequentialism have counterintuitive outcomes, that is to say, unconvincing responses in concrete situations or in thought experiment situations. If consequentialism is an adequate perspective, the defect of many forms of deontologism may consist in their excessive rigidity, which leads us to undervalue beyond measure the weight of the effects of action in evaluating whether the latter are wrong or right. From this point of view, the merit of consequentialism is its great flexibility. But I think that many of the flexibility requirements that have been met by consequentialism can be adequately satisfied by deontology if, instead of advocating a deontological theory based on absolute duties or obligation, we adopt a theory that operates with prima facie duties, namely obligations that admit exceptions. With regard to the second alternative, the alternative between monism and pluralism, I believe that it is right to defend a theory of moral obligation that contemplates a plurality of prima facie obligations. Moral reflections has produced a certain number of pluralist theories based on prima facie duties. About the biomedical sphere, I think that a good model of theory must include among its prima facie principles at least non-maleficence, beneficence, autonomy, and justice. Maleficence is a principle that imposes the duty of not hurting. The ancient Latins said primum non nocere or neminem ledere, that is to say, first thing, do not harm anyone. Beneficence means the promotion of well-being. It is the positive part of non-maleficence. The principles of beneficence asserts that the duty of positively implementing the good. Beneficence requires not just omissions, but positive acts. The principles of autonomy or self-determination expresses, in terms of obligations, prescribes respect for the free and informed choices of others. Justice means imposes fairness in the distribution of goods and harms. However, I think that perhaps it is necessary to add to non-maleficence, beneficence, autonomy, and justice something like veracity and or fidelity. That is to say, the duties of telling the truth, the obligation not to lie, and or to keep our promises. The ancient Romans said, "Pacta servanda sunt." From these five basic principles, it is possible to derive all our concrete duties in biomedical context. But while pluralist theories based on prima facie duties are more in line with our reflective intuitions, they face a problem that monist theories do not present, the problem of the conflict between principles. The great problem of pluralist theories based on prima facie duties is putting these principles in a hierarchy, in a hierarchical order, namely to establish the rights of precedence. What comes first between beneficence and autonomy when they conflict in a specific context? What comes first when non-maleficence conflicts with justice? Pluralists are not disarmed in the face of the phenomenon of conflict, and there are several strategies that can help us deal with this thorny problem. But it must be said that it's neither in the task nor in the possibilities of a plausible moral theory to be complete, in the sense of telling us, in all cases, which principle take precedence and which must yield it. Despite all that can be done to improve conflicts resolution methodologies, we must point out that the margin of indeterminacy in moral theories is unavoidable. And this is a good thing, not a bad thing. Because moral theories should not be a handbook of answers to be applied mechanically, without leaving room for autonomy of judgment by the evaluated subject. Thank you very much.